Thank you very much. Can everybody hear me okay? All right, good. It's a great pleasure to be here tonight, and I would like to extend my thanks to Jonathan Latham and Allison Wilson in the Bioscience Resource Center for organizing my visit here and for hosting me at their home and for all the great hospitality. I've exchanged emails with them both over the years, a few phone calls I think too, but it was a pleasure to finally meet them after all these years. And I want to, in particular, Jonathan in particular thanked Allison, and I want to in particular thank her as well, because Allison was one of the, I think I had at least 7, if not 8, experts that were on the review team of the book to make sure it was rigorous, that it is rigorous. And Allison was one of the scientists who really gave me just extensive assistance whenever I felt that we needed to, that more research was needed to back up some point. Allison would dig into the research and we discuss the findings and go deeply, well beyond the abstracts of the studies so that there could be an endnote backing up the main text even more solidly for the experts who wanted to dig into it in a really rigorous manner. So Allison, again, thank you so much for all of your assistance, because you did help make this book as well documented as the other scientists have praised it to be in their endorsements. I'm also would like to thank Sarah Davidson Evanega, who is the director of the Cornell Alliance for Science, because she's here this evening, and I'm delighted that she has arranged for all 25 of the current participants in the Alliance's Global Leadership Fellows Program to also be in attendance, and she even has arranged for all of them to receive copies of my book, and I think that's terrific. I also think it's wonderful that she reorganized her very busy schedule so that she and one of her dynamic staff members, Astu, could meet with me this afternoon before I gave a guest lecture on campus. And so again, thank you very much. I appreciate it, and I look forward to chatting with some of the fellows afterwards and signing your books for you if you would like. I just also want to mention that the meeting that we had this afternoon was quite cordial, very fruitful, and we both acknowledged that we are essentially allies, because according to its mission statement, the deepest goal of the Alliance for Science is to advance science and promote evidence-based decision-making. And the organization that I founded and direct, the Alliance for Biointegrity, is dedicated to the same goal. So we recognize that we should, as much as possible, be allies, but we understood that we do disagree on some ways of looking at facts, and that we will respectfully disagree, and that we will also continue to dialogue with one another so that we can enrich one another's perspective. And I'm certainly willing to learn from the Alliance, and they seem to be willing to learn from the evidence in my book. So I think it's a win-win. And I'm glad that so many individuals affiliated with the Alliance are here, because you will be learning about a substantial body of evidence with which many of you are most likely unfamiliar. And in this vein, the words of the Alliance's visiting fellow, Mark Linus, I think are highly appropriate. When speaking in regard to the issue of genetically engineered crops, Mr. Linus has stated, "There is need for everyone to drop their existing preconceptions and have open-minded and respectful discussions with everyone from all perspectives, because this subject is highly controversial and raises high emotions." I fully agree with Mark Linus on that. And so let us proceed in the open-minded spirit that Mark Linus has called for. Now, I'd like to begin by posing a question, and that is, what do you think would happen if, through a miraculous flash of illumination, everyone in the world suddenly gained full awareness of the actual facts about genetically engineered foods, and all opinions about them became firmly based in solid science. Well, if we adhere to the routine rhetoric of most of the proponents of these products, we'd have to predict that such a universal wave of enlightenment would cause all opposition to them to vanish. And that's because in the rendition of reality that they propound, the opposition has been based primarily in ignorance, and concerns about risks have been due to a lack of scientific understanding. But in actuality, in the world we actually inhabit, the phenomenon that would rapidly vanish is not the opposition to genetically engineered foods, but the foods themselves. And that's right. If the facts became widely known, the entire genetically engineered food venture would quickly collapse. And that's because, as research in several different countries has consistently shown, the more that people know about genetically engineered foods, the more they actually do learn the facts, the more concerned they become about them. And that is why, despite their repeated pretensions about wanting to educate the public, many biotech promoters, and I specify many, not most or not all, but many biotech promoters have strenuously striven to suppress or distort critical facts. Moreover, this twisting of the truth has reached massive proportions. My book documents case after case in which eminent scientists and scientific institutions have stooped to deception in order to enable the genetically engineered food venture to advance. And it demonstrates that if the truth had been told and the facts openly and honestly aired, these novel products would never have come to market in the first place, and we would not be having this discussion this evening. Further, the sheer magnitude of the deception in itself demonstrates how strongly the evidence as a whole weighs against the safety of genetically engineered crops. Because if it were as supportive as so many of its advocates claim it to be, there would have been no need to distort it. Obviously, if one has the evidence on one's side, one just presents it quite simply and straightforwardly. There's no need to distort evidence. There's no need to suppress unpleasant facts if the facts actually back you up. And that is a very important point to keep in mind. Now, let's examine then some of the key claims about the safety and the acceptability of GE foods, GE meaning genetically engineered, not the electric company, of GE foods, and compare them to the actual facts. An exercise that will make it clear why widespread knowledge of these facts would doom the colossal venture that's producing and promoting them. Now, one claim is that genetic engineering is really an essentially natural process, that there's a seamless continuum, and that term has been used, seamless continuum between the very earliest and simplest forms of agriculture, just selective breeding, and the current round of genetically engineered crops, seamless continuum. Well, not all scientists agree with that. In fact, many eminent ones have vehemently disagreed. One of them was George Wald, a Nobel laureate biologist who was a professor at Harvard University, and he stated in regard to genetic engineering that it is the biggest break in nature that has occurred in human history. And he continued, such intervention must not be confused with previous intrusions upon the natural order of living organisms. Another eminent biologist who has disagreed with the characterization of a seamless continuum and the essential naturalness of genetic engineering was Dr. Lieb Cavalieri, who, when the American Association for the Advancement of Science held what I believe was his very first ever forum on genetically engineered foods, Dr. Cavalieri was selected to represent the viewpoint of science, There were only two other main speakers. One was from Monsanto, representing the view of industry, and another representing the view of consumers. So this scientist who was selected to represent the position of science has stated that those scientists who are claiming that genetic engineering is essentially very similar to traditional breeding are perpetrating a sham. That was his word, a sham. He said it's disgraceful and that they should be ashamed of themselves. Let's move on to another claim. I think we have all heard the claim repeatedly. It's one of the main claims that is used to back up the safety of genetically engineered food, to support the claims of safety, is that no product of genetic engineering has ever been linked to harm to humans. But that's just not true at all. In fact, the very first ingestible product of recombinant DNA technology, which is the technical term for genetic engineering, caused a major epidemic in the United States in 1989 and 1990. Dozens of Americans were killed. According to the most recent estimate of the Center for Disease Control, between 4,000 and 5,000 Americans were seriously stricken, hundreds of whom remain invalids to this day. Now, what was that product? It was not a whole food. At that point, genetic engineering had not produced and commercialized a whole agricultural crop. This was a food supplement of the essential amino acid L-tryptophan. L-tryptophan is safe. We need it. Our bodies don't synthesize it, so we get it from our food. But millions of people around the world for many years have been taking supplements of it because it was actually a natural sedative, helped people sleep if they had insomnia. And there had never been an incident, a known health incident with any supplement of L-tryptophan until a Japanese manufacturer had changed its manufacturing process by reconfiguring the bacteria that are used to synthesize L-tryptophan through the genetic engineering process. These bacteria were given just some extra copies of their own genes. They were not given foreign genes to express, but just the forced overproduction of a substance that they need and they ordinarily synthesize for themselves. That forced overproduction apparently destabilized, stressed their metabolism in such a way that at least one, if not more, unusual contaminants were created as unintended byproducts that caused an ordinarily safe supplement to become highly toxic. And the evidence as a whole, and I'm glad that Jonathan decided to read that endorsement from Dr. Naylor, who led one of the research team at the Mayo Clinic, because as you could hear, the discussion of that incident in my book is, according to this expert, the most comprehensive, best balanced, most balanced and most accurate he's read. And so as the chapter in my book devoted to this tragedy does demonstrate, not only has genetic engineering been linked to this and not been absolved from having been the cause, the evidence as a whole strongly points toward genetic engineering as the key cause of that toxic contamination. Now, I say strongly points, it doesn't conclusively prove it. It couldn't. The bacteria have been destroyed. At this point, we couldn't have conclusive proof. But we do know that the finger of doubt points very strongly, according to all the evidence we have, at the genetic engineering process. What's another claim? By the way, and I could maybe go into this more in question and answer, that incident, even though it didn't involve a whole food, does have implications for every edible product that's created by genetic engineering, because as I emphasized, no foreign genes were involved. What was involved was the forced overproduction of some chemical. And experts have recognized that any time we force a living organism to overproduce a substance, even if it's one that it ordinarily creates, that can create problems. That can create, especially in the case of bacteria or plants, that can create serious unintended side effects, because unlike animals, bacteria and plants have to rely on chemicals for their primary defenses. And they can manufacture a whole range of dangerous chemicals in really a chemical warfare with their predators or their competitors. And if the disruption, if the metabolism of bacteria or plants is disrupted, there can be unintended side effects. There is even the risk, as many experts have recognized, for completely novel toxicants to be produced. And in the case of the L-tryptophan, there were novel toxicants. There were novel substances that had not been found synthesized by those bacteria before. Okay, there's another claim that there's an overwhelming scientific consensus that genetically engineered foods are safe, and some of the claimants have gone so far as to state that every respected organization that has reviewed the issue has concluded that genetically engineered foods are just as safe as other foods. Well, that's not true either. Actually, the very first comprehensive review of genetically engineered foods that was conducted by a team of independent scientists. When I say independent, I mean independent of industry, money, and other influence, came down very strongly with the conclusion that genetic engineering is very different than traditional breeding, that it entails a unique set of risks, and that the foods that it produces cannot be presumed safe, should be regarded as posing potential problems, and that each of them needs to be carefully tested and demonstrated to be safe through standard scientific procedures before it is allowed on the market. Now, interestingly, that team of scientists actually was at the FDA, the US Food and Drug Administration. That team was the biotechnology task force of the US Food and Drug Administration that had been impaneled, I believe it was in 1990, by the administrators to assess the issue. And that team included experts from all of the main divisions of the FDA that were relevant, that should have provided input: microbiology, toxicology, Office of Special Research Skills, Center for Veterinary Medicine, because it was known that farm animals would be eating a very high percentage of their diet would be derived from genetically engineered crops. And uniformly, the memos that were being sent by those experts to the FDA biotechnology coordinator and through him to the superiors higher up were, as I said, concluding genetic engineering is different, it leads to different risks, these foods have to be carefully tested. So pervasive was that opinion within the FDA's scientific branch that by the way, I only know, and the world only knows, what the FDA scientists said because of the lawsuit that I filed that did force the agency to divulge its internal files. Otherwise, we wouldn't know. They'd still be hidden and buried. But those files demonstrated, those memos were there within the 44,000 pages of documents that the FDA was forced to hand over. And I think one of the most telling memos that was written by an FDA compliance officer whose job it was to summarize to review the input coming from the scientists and basically summarize it for superiors, wrote a very powerful memo in January of 1992 to the FDA biotechnology coordinator, protesting that the policy that the FDA was developing, which was very clearly not integrating the input and the warnings from their own scientists, she protested that the FDA was, quote, trying to fit a square peg into a round hole by trying to force an ultimate conclusion that there is no difference between foods modified by genetic engineering and foods modified by traditional breeding practices. And then she declared, the processes of genetic engineering and traditional breeding are different, and according to the technical experts in the agency, they lead to different risks. That's on the website of the Alliance for Biointegrity. I have posted and have posted since early 2000 24 key documents from the FDA files, and that one I've got as number one. That's number one because I think it's the most important. But you can read it and memos from other FDA experts posted there on the website, and you'll get a flavor of what the FDA scientists actually did say. Now also, in the file, there was a letter from the FDA's own biotechnology manager written to a Canadian health official conceding that at that point, there was not a consensus about the safety of genetically engineered foods within the scientific community at large. So the FDA knew that it's within its own scientific branch, the overwhelming consensus was that genetically engineered foods cannot be presumed safe and need to be tested. And the FDA's biotechnology coordinator also admitted that there wasn't a consensus within the scientific community at large. So there never really has been a scientific consensus about the safety of these foods. And over the years, there are more and more respected organizations that have raised concerns and eminent scientists that have raised concerns too. That's not saying that there are not a large number of institutions and scientists that say they think these foods are safe. There are. But there certainly are not enough to claim there's an overwhelming, near unanimous consensus, which claim is often made. In fact, just another example, in 2001, an expert panel of the Royal Society of Canada, that nation's premier scientific body, issued an extensive report, among other things declaring that it is, quote, scientifically unjustifiable, unquote, to presume that genetically engineered foods are safe, and that the default presumption, and that's their term, default presumption, for every GE food should be that the genetic alteration has induced unintended and potentially harmful side effects. Now, based on extensive analysis, the Public Health Association of Australia also expressed concerns about the risks of genetically engineered foods, and the eminent medical journal, The Lancet, has also criticized the notion that these foods are no riskier than conventional ones. And its editors have stated that there are, quote, good reasons to believe that specific risks may exist, unquote. And the British Medical Association has likewise sounded a similar theme. Also, just most recently in January, I believe, of 24, I'm sorry, actually I think it was January of this year, a statement signed by over 300 experts was published in a peer-reviewed scientific journal stating that they didn't recognize, the experts, they didn't recognize that genetically engineered foods had been demonstrated safe and that there was no consensus about their safety within the scientific community. Let's move on to another claim. We hear it many times, and it's supposed to give us comfort, that these foods are well regulated by the Food and Drug Administration. That is not true at all. For one thing, the administrators at the Food and Drug Administration, faced with all that input for their scientists, what did they do about it? They covered it up. They ignored it, they covered it up, and they pretended it didn't exist. And the policy statement they released in May of 1992 claims that the agency was not aware of any information showing that foods derived through genetic engineering differ in any uniform or meaningful way from other foods. It's very difficult, I think, to read the extensive input from the FDA scientists and then read that statement and say, you say you're not aware of any information? You know, if they'd said we're not aware of any proof they're dangerous, they could have been within the bounds of truthfulness. But to say no information, I don't know, they just must have a very strange definition of information. They also claimed that there was an overwhelming consensus in the scientific community these foods were safe, that they were generally recognized as safe and didn't need to be tested. And of course, their own files show that they knew there was not general recognition of safety in the scientific community at that point, nor has there been at any point since then. And so the FDA in May of 1992 declared that they weren't going to require any safety testing at all. And that is still the policy. In the United States, the FDA essentially has zero regulation of genetically engineered foods. Any regulation coming from a governmental agency is not coming from the FDA. There's some regulation coming from the USDA and some regulation from the EPA, but there is none from the FDA. Now, by stating what it is stated and taking the policy it has taken, the FDA has not only violated ethical standards, it has violated US food safety law. Because by law, foods containing new additives and genetically engineered foods are under the purview of this statute and the accompanying FDA regulations. Foods containing new additives, if the additives don't have a history of safe use prior to 1958, these foods are by law presumed unsafe, and the manufacturer has the burden of demonstrating they're safe, proving they're safe according to standard scientific procedures, and the standard of proof is high. They have to prove they're safe to a reasonable certainty of no harm. Not absolute safety, because nothing is absolutely safe, but reasonable certainty of no harm. And the FDA has basically not only turned its back on the law, it has evaded the law and violated that law in allowing genetically engineered foods to come to market without the requirement of a smidgen of safety testing. In fact, the FDA does not even require manufacturers to give it notice before they market a genetically engineered food. So an unscrupulous manufacturer could have dumped any number of GMOs that had been in test plots and hadn't turned out well on our market without having to tell the FDA at all. That's basically the situation. Now, many of you have heard about some kind of review process that the FDA is conducting. That's actually not a scientific review. It was set up by the FDA to give the illusion that there is actually some review going on, and there's a memo in the file that discusses that they're going to have this voluntary review process to avoid the impression that they've given the industry complete self-regulation. But they have given the industry complete self-regulation. And so it's a purely voluntary consultation process, and the FDA doesn't even ask for or get original data, any data from any tests. And even the FDA Biotechnology Coordinator has admitted in a rare moment of candor that this voluntary consultation process does not amount to a scientific review. And there's at least one other occasion in which the FDA officially has also acknowledged that this program is not a scientific review. And yet in public, the FDA often tries to purport that it is, and most proponents of genetically engineered foods will tell you that genetically engineered foods are undergoing rigorous scientific review from the FDA. And I know there are several members of Congress who have been deeply confused on that, and I've talked to a representative who, from my district, who was shocked when he learned the truth, because he thought the FDA was seriously, rigorously regulating these foods, testing them, reviewing them. So that's part of the disinformation that has been permeated. Now, just briefly, why would the FDA do this? Why would the FDA adopt not only a lax policy, but an illegal policy? Well, in 1986, a directive to federal administrative agencies was issued by the Reagan White House, establishing a policy to foster the biotech industry. And this policy has remained in force throughout all successive presidential administrations, including the current one. Now, how about the claim that genetically engineered foods have been carefully tested and been proven safe? And you may be wondering, well, even if the FDA doesn't require testing, surely we know that the European Union and other nations do require testing. Well, there is some testing required elsewhere, but it certainly doesn't meet the standard of rigorous testing. In fact, that report by the Royal Society of Canada that I referred to earlier not only lamented the lack of adequate testing of genetically engineered foods at that point in time, it noted that there weren't even any validated test protocols to assess their safety in what it termed a biologically and statistically meaningful manner. Thus, all of the many claims of safety up to then, and we're talking about GE foods haven't been on the market for over 5 years at that point. All of those claims that they'd been demonstrated safe, according to the expert panel of the Royal Society of Canada, didn't hold water at all because there weren't even any validated test protocols at that point. Now, the European Union didn't even start requiring toxicological feeding studies employing the whole food until 2013. Up until that point, the requirements were extremely lax and certainly did not meet the kind of safety testing that the FDA's experts had said would be necessary, or the experts on at the Royal Society of Canada that issued their reports. They stated that rigorous testing with the whole food was needed. That wasn't even required for the first time by the European Union until 2013. And even then, the requirement was only for medium-term testing. No more than 90 days was required. But 90 days is too short. Many experts have recognized that, and there's actually evidence to that fact, because there's a 2-year study that was conducted a few years ago, a very rigorous one, that took a genetically engineered Roundup resistant variety of genetically engineered corn, or maize, the way it's referred to in the rest of the world, that Monsanto had produced. Monsanto had subjected that genetically engineered corn variety to a 90-day test. There were some differences that were detected there. Monsanto dismissed them as of not biologically meaningful, and the European Union regulators agreed with Monsanto, and they approved it. Well, that same genetically engineered corn, a few years later, a team in Europe of independent university researchers took that and they put it through a very rigorous 2-year study, which is a long-term study. And they detected several problems. And this study was published in a peer-reviewed journal in 2012. The results were highly damaging to the image of the Roundup-resistant crop, that one and other ones, because of the way the study was designed, because they demonstrated a high degree of damage to the rats that ate that crop. The studies revealed that Roundup, not only the Roundup herbicide, but that the genetically engineered maize each independently caused serious injury to the livers and the kidneys, abnormal onset of large tumors, and increased mortality. And such problems had not been seen in Monsanto's study because many of them took longer than 90 days to develop. For instance, the first tumors didn't even form in the male rats until the study had gone a month longer than Monsanto's, and the first tumors in the females didn't appear until the 7th month, 4 months after Monsanto's study had ended. And most of the tumors weren't even apparent until 18 months had elapsed. Further, the kidneys and the livers weren't the only organs adversely impacted. Statistically significant damage was also detected to pituitary glands and mammary tissues, and all the negative effects were observed for the 3 basic categories of experimental rats: those that ate the GE maize sprayed with Roundup, those that ate unsprayed GE maize, and those that ate no GE maize at all and instead were just given a small amount of Roundup in their drinking water, and that was an amount similar to the amount that would have been ingested in a dose of the sprayed maize. Now, because regulators have often not required any toxicological feeding studies, and none, as I said, longer than 90 days, that study was very dangerous to the image of genetic engineering. So it was vehemently, and I would say viciously, attacked by many proponents, and repeatedly attacked so strenuously that eventually they were able to pressure the journal that had published it into retracting it. And one of the factors that may have contributed to that retraction was that the editorial board of the journal made an addition of a former Monsanto executive to that editorial board. That happened prior to the decision to retract the study. Now, my book examines that very carefully and shows the retraction did not follow the standard protocol for retracting. It was really illegitimate. The reasons given were wrong, and the attacks on that study were wrong. Many of you may want to question me on that, and I'll let you during question and answer, but my review of that, my discussion of that, has been vetted by the scientific review team. Now, even the shorter-term studies have often detected problems, but all too often the regulators have failed to notice it. For instance, a team of university scientists examined the data from 19 of the feeding studies on soy and corn varieties that had already gained regulatory approval. Products containing, and I'm talking about the EU and other countries because the FDA gives no formal approval. They already just presume they're all safe. Now, these products comprised 83% of the genetically engineered foods that people have been regularly eating. They found that 9% of the measured parameters, including blood and urine biochemistry and organ weights, were significantly disrupted in the animals that ate the genetically engineered feed. Moreover, and this is important, the greatest disturbances were to the kidneys of the males and the livers of the females. And the scientists emphasized that because livers and kidneys are the major reactive organs in cases of chronic food toxicity, these results should be viewed as danger signs, something the regulators had failed to do. Now, many experts have stated, who have reviewed the evidence, stayed on top of it, have stated that not even one genetically engineered food has been demonstrated to be safe, let alone all of them. For instance, David Schubert, an endorsement from whom Jonathan read, a professor at the prestigious Salk Institute for Biological Studies, has recently written, quote, "As a medical research scientist who published a comprehensive peer-reviewed critique of genetically modified food safety testing, I can state confidently that it is false to say such foods are extensively tested and proved safe." Now, in light of all the preceding facts, one may marvel at the certainty that's constantly expressed about the safety of GE foods by those who promote them. Further, when even the most ostensibly authoritative of these assertions are subjected to careful analysis, their falseness is conclusively confirmed. For instance, in October 2012, the Board of Directors of the American Association for the Advancement of Science released a statement in support of GE foods, which declared that extensive testing has shown they're safe to eat. And to support this assertion, they primarily relied on an apparently impeccable source, a report issued in 2010 by the European Commission reviewing 131 research projects the EU had funded. But they failed to note that only 22 of those projects even related to food safety. Moreover, when a team of independent investigators, which included 2 molecular biologists, analyzed the 10 most recent of those 22, they concluded, quote, "Within those 10 projects, there is astonishing little data of the type that could be used as credible evidence regarding the safety or harmfulness of GM foods," unquote. These researchers found that only one of the projects resulted in published studies on food safety, and that those 3 studies, in their words, do not show the safety of GM food, but rather give cause for concern. What's more, because no bioengineered crops that are on the market were involved, none of those studies even involved a single GMO that's actually on the market, even if the tests had demonstrated safety, those results could not be extended to any of the products that people are actually consuming. Further, none of the other 12 projects demonstrated food safety either. In fact, their titles indicate that they were primarily focused on evaluating test methodologies or gauging consumer attitudes. Thus, to the extent that that EU report reflects on food safety at all, it presents grounds for caution. Now, I'd like to shift gears just a bit, and I'll only be speaking for maybe 5-7 more minutes, and then I want to throw it open for question and answer. I'm sure that there are many people here who have a lot of questions or criticisms, so anyway, we can go into it. I want to have plenty of time for that. But especially because we have representatives from the Alliance for Science here, because that alliance is primarily funded by the Bill and Melinda Gates Foundation, because that foundation has been lavishly funding many projects involving genetic engineering around the world. But I do have to mention a point that Dr. Dave Evanega wanted to emphasize and that I already knew, but it bears repeating. The bulk of the money that the Bill and Melinda Gates Foundation is devoting to agriculture is not going to genetic engineering. It's just there's so much money involved that the smaller percentage that is going to genetic engineering is still rather substantial. Correct me if I'm wrong on that. And it's because that money was actually essentially earned through computer programming by the most famous computer programmer in the world. I think it's quite relevant for that and for several other reasons to just briefly examine genetic engineering from the standpoint of software engineering, because we've just been looking at it from the standpoint of biological science. Now, why, other than the fact that Bill and Melinda Gates Foundation is involved in promoting genetic engineering, is it relevant? Well, the main reason it's relevant, even if the Gates Foundation weren't involved at all, is because both software engineering and genetic engineering are making revisions to very big and very complex information systems. Now, in the case of software engineering, the information systems were actually created by the human mind. And the revisions are made usually by people that wrote the system, or if they didn't write it, they have full access to all of the source code. They know what all of the planned interactions are supposed to be. But what has been learned in the case of software engineering, and it's been learned the hard way, it's taken several years to learn that lesson, is that when even human-devised systems, information systems, reach a certain level of size and complexity, one can not make even the presumably most precise and surgical revision to improve performance made by the man or woman who actually wrote the system and still presume that there have not been unintended disruptions somewhere else in the system. That's been learned the hard way. And in fact, the default presumption now in the case of software engineering is that any revision is probably going to create some other disruption that could not be predicted and could create a bug in the system. And so actually for many years, the textbook recommendation was if you find a bug in the system, the best thing to do is to leave it alone. Because in trying to repair the bug, you are likely to create a disruption somewhere else. And then what you've got, it's better to have a system with a bug you know about and can work around than to try to fix the bug and create a bug or bugs that you don't know about that could create bigger problems. And that's why also increasingly software engineers have begun to try to develop designs so that they will insulate various modules of the program from one another to minimize the risk that modules that you do not want to interact won't interact. Minimize the risk that they will interact, sorry. That was grammatically incorrect, but I hope you got the idea. It's called object-oriented design, but essentially it's trying to isolate and insulate the different modules of a system, so if you make a revision to one, there's less chance that it will somehow interact with another. But they cannot rule out such. They've minimized it over the year, that risk, but they have not been able to eliminate it. Now, it's very important to note that, now many of you are thinking, well, geez, I mean, the software programs in the earlier versions of Windows, I mean, they had a lot of bugs. How come? Well, in non-critical life software systems, yeah, there were bugs and you'd just bring them out with the bugs, and other people would tell you where the bugs were, and it would years and years trying to fix all the bugs. But there's a category of software in which we cannot be so complacent about the existence of bugs, and there has to be extremely rigorous testing. And that is with the category of software that's referred to as life-critical software. This is critical. This is software that if a bug does bring down that system or creates a major disruption, human life can be lost. So one example would be the guidance program, the software that is the guidance program for an airplane, okay? If that malfunctions, you're going to have airplanes falling out of the sky. So we have to be very careful with those. Also, software that's used in programming medical devices such as pacemakers or X-ray therapy machines or just X-ray machines. And interestingly, the industry standard and the government international regulatory standard is when it comes to life-critical software, then again, there is a presumption that any refinement, any revision, even if it's made to improve the performance, is presumed to have created a disruption. And it's standard procedure within the industry anyway, but it's also required by regulators, FAA in the case of airplane guidance software, FDA in the case of medical devices, that there is rigorous testing and retesting of that program to put it through just about every conceivable permutation and combination, to even circumstances that would be very rarely encountered, just to make sure that that system still will function well. Now, what happens in the field of software engineering? Here in software engineering, these information programs are far bigger. And in Bill Gates's book, The Road Ahead, he mentions, he has a few sentences mentioning that the genome, the human genome he was talking about, but it applies to the genome of any agricultural crop, is much vaster than even the biggest human software program. And of course, it's less understood. We didn't write those programs. They're extremely interrelated. They have complex interactions, dynamics, and operating rules that we don't know about. Just knowing the genetic code, which is essentially the protein code, is the code that we're most familiar with, that does not tell us all the operating dynamics, the way that these bioinformation systems interact. We don't know that. And here, though, there are not just minor, but actually fairly radical revisions being made to these information systems, and the presumption on the side of the FDA food safety people is no disruptions were made. We presume it's safe. If you go down the hall at the FDA to the Division of Medical Devices, they have a completely opposite viewpoint. When people who wrote the programs are making precise revisions, they say, we presume there were unintended disruptions that could be deleterious to human life. You've got to demonstrate this is safe according to very rigorous testing, the likes of which really, if we want to talk about commensurability of the kind of food safety testing that has been done with genetically engineered foods, it doesn't come close to the level of rigor that's applied to testing after revisions of life-critical software systems. So there's a huge mismatch, and I think it's very important that the software engineers begin to examine genetic engineering from the standpoint of their own discipline. Because again, as a matter of science, the human race has learned a lot about the inherent risks of altering complex information systems. And we've learned that we have to proceed with far greater caution that has been exercised to date in the field that's called bioengineering. In fact, and there's not time to go into it right now, but when one actually analyzes what is referred to as bioengineering from the standpoint of software engineering or civil engineering or chemical engineering or any other field of engineering, it's very clear that the principles and protocols that really are followed carefully by these other fields are not being followed by so-called genetic engineering. And so in many ways it's quite legitimate not to give it the dignity of being called a field of engineering at all. But I think having said that, I will wrap up for what I'm saying. I thank you thank you all for coming, for your attention. And now I'll invite Jonathan to come up to to be the moderator for the question and answer session.
They moved it straight off.
Yeah, okay, that works. I have a question over here. Can we do this through the microphone? If possible, we'll try to get to you in good time. So people hold up their questions, their hands, if they're
Mr. Drucker. All right. Mr. Drucker, are you ready for us? Hi. My question involves substantial equivalence. My understanding is that because genetically modified food were considered substantially equivalent, that was the rationale for the FDA, USDA, and EPA not to test them. Now, as an attorney, I'm wondering if you could explain how they could claim substantial equivalence on the one hand, and then patent the seeds and the genes on the other. It seems like double talk to me.
You know, my English is not great, and there was a bit of echo. Could you just, there was something about substantial equivalence. Yeah. Just,
so the question was, is it a double standard to argue that there is substantial equivalence and also a patentable organism? But also the question had to do with, I think Tony also was asking whether substantial equivalence had a role to play in the testing of GMOs. Is that correct, Tony?
Yeah, I mean, my understanding is that because of substantial equivalence, that's what GMOs were given, that the regulatory agencies use that as rationale for not testing. So on the one hand, they have substantial equivalence, and yet Bayer, Syngenta, Monsanto are patenting their seeds.
Many people have raised that point, and I don't have to repeat that. I think it's just somewhat, in many people's eyes, a glaring inconsistency that on one hand, the claim is made these crops are substantially equivalent to their conventional counterparts, or on the other hand, the patent, they go to the patent office and say they're so unique that we should get a patent on them. But you also, I think, asked a question about has substantial equivalence been relied upon as a regulatory standard for saying, well, if we can establish substantial equivalence, then can the foods be deemed safe? And for many years, in the European Union and other parts of the world, that was the main standard being used. It's been criticized by many scientists who've said it never was a well-defined standard, and that was part of its utility. It was so vague that you could kind of use almost anything to claim substantial equivalence. And the Royal Society of Canada report that I mentioned in 2001 specifically was critiquing the use of the concept of substantial equivalence by Canada in the EU and other countries at the time. And they, in particular, was saying that was scientifically unjustifiable to try to establish safety based on some standard of substantial equivalence and basically evading testing, toxicological testing, employing the whole food. And, but as I mentioned, really substantial equivalence, I think, still was relied on to a substantial degree at times, even right up until 2013 in the European Union. And anybody can correct me if I'm wrong on that one.
I have a little bit to add to that, which is that substantial equivalence was never, in many ways, a scientific concept. So it came out of the Organization of Economic Cooperation and Development. And so basically it was developed by a non-scientific institution, and they developed it as a way of pushing a kind of fudge factor that would enable a plausible sounding risk assessment process, but it was never, it never passed through the peer-reviewed scientific literature, for example, as a valid concept.
So another question.
Thanks so much. My name is Claire. I'm a genetist, and I've been working on breeding And actually, I have some materials that have been released to farmers using conventional means, but with one approach of biotechnology called marker-assisted. One of the big challenges that we are facing is...
I gotta come close to you because I'm not picking it all up, but I want to hear what you're saying.
Okay.
So I'm sorry. There's a lot of echo and my hearing's not picking it up.
I am a geneticist and I've been reading. So I look at the genes in the plant and I try to look for the source of the kind of character that I needed to introduce into what we call the farmer preferred or adapted variety. And sometimes to move the kind of genes that you require using conventional approaches can really take a long time. And most times probably you run it for a number of years and give up. But now as the breeding approaches are advanced, because originally we were just selecting materials, then later on we started crossing, then sometimes we started bombarding them with radioactive rays, then sometimes using conventional approaches we still manipulate and increase the number of genes, and somehow better crops emerge. Now, as all these tools advance, there came the genetic engineering era. And now with this, it's possible that sometimes you use this approach and you get some good materials. Now when you get these materials, it's not that you have solved error, you have something. So in the situation where you are trying to move one gene using conventional means and you're failing, and actually disrupting what the farmers need, but you have one approach that is helping you to deliver the product. What do we do? Should we just stop there, or we should actually use the approach that gets you a result, and then science continues advancing?
Did everyone get the gist of the gentleman's question? So I think we have to separate the issue of efficacy from safety, and also have to separate the issue of potential benefit from risk. Because if we're going to be developing a food and saying, well, I can do it more quickly by using recombinant DNA technology, and maybe I won't be able to get the result at all through conventional breeding, shouldn't we go ahead? Well, if there is a reasonable certainty that what we're going to be doing is safe, and that we can demonstrate its safety, and that we're willing to commit the resources to demonstrating its safety, then perhaps that's a good idea. But we have to understand, we can't just say, well, because it's going to be quicker, and because I want to do it, and because it will, I might not be able to do it through conventional breeding, and just say, and therefore I want to do it without looking at the risks and without seriously considering them. I don't think that's wise policy, because are we ultimately doing the people for whom we're developing that crop a favor if we're actually marketing a food that is creating long-term health problems for them? And again, most food safety problems are chronic, they're not toxic. So people aren't going to be dropping dead the day after they eat a new genetically engineered crop, or even a week afterwards. It can build up over time. That's why that 2-year study is very important. Those rats weren't dropping dead even after 90 days, but after 2 years, there were serious problems that were detected. And those weren't even multi-generational studies, which also many experts say should be done. So I think it's a matter, and it's very important to note, certainly as a matter of United States food safety law, it is actually not only inappropriate, but illegal to try to offset risks with projected benefits. That's very proper and appropriate in the field of pharmaceutical drugs, because we're dealing with, first, they're not over the counter. They're only supposed to be used for people that have a specific problem, and that drug can give a benefit. It may have side effects. In fact, we know most pharmaceutical drugs do have some side effects. They're not just safe per se, but then it's a matter of, an informed, educated decision made by the physician, and ideally in consultation with the patient, informed consent. Here's our best estimate of your risk if we do nothing. Here's the best understanding of the risk if we do something. Here's the projected benefit. And if it all makes sense, then maybe it's worth incurring the side effect associated with the drug to save your life or to save you from something even worse. But that's where you do offset risks with projected benefits. But it's really inappropriate in the case of food, because food is all over the counter. Certainly according to US food safety law, food is supposed to be safe. Can't be absolutely safe, nothing is, but reasonable certainty of no harm. So that's my answer, that I think we know enough now to know that we should regard, and by law at least in the United States, those foods should be presumed unsafe until demonstrated safe. And I would say to you, and I know that you often face dilemma and you want to do good and use something good, I would just say that don't be looking for shortcuts when it comes to safety testing. That's just my perspective based on everything I've read. And I think that most people who read my book would agree with me that we shouldn't be short-circuiting safety testing. We should actually, if we're going to do genetic engineering in agriculture, then we should be prepared to not play games about the risks, to really understand the evidence, to be upfront about the risks, and certainly to follow the law anyway. And if we're not going to follow the law, it should be because there's been an open and honest debate, and the US Congress, with fully understanding what it's doing, amends the law to give a special exemption to GMOs. That's my perspective. I don't know if you would like to ask a follow-up to that.
All these materials that are produced using whichever means, whether conventional or GMO, goes through some levels of testing. In fact, all the countries have regulatory systems that you have got to go through. And it appears to me that the general consumer population seems to think that the same regulatory system that we used previously, and that credited what we now call our locally adopted organic food, can no longer be trusted. And if we cannot trust such systems, who else can we trust? Because nobody would actually develop something that can actually harm any other person, because it would eventually return around to the same person anyway. But the issue is, I do not see, like, I read your book. Yes, it's come through your book, but on the first pages, when you read what Jane, in the forward, Jane Goddard has said, she refers to Rachel Carson's statement of the 1960s. She said, no single approach can solve the problems. The people who are developing GMOs are quoting the same Jane Goddard. They say, look, we have used this as an approach to solve human problems. We can also attempt this as an approach. Whichever gives us a product which we shall test through the regulatory systems, and the product is better, we go by that. And that draws me to your chapter 7, when you're looking at issues to do with, I think, environmental issues. And when you look at the precautionary principle, is saying, look, if you're absolutely not sure of something and you are in a crisis, you can actually make a decision to move ahead. But if you're not sure about something and you're comfortable, you can make a decision not to go ahead because you have an option. But in some of the cases, we actually don't have option. But when you look at a country like this, where we have already too much food, you can make a decision not to use the GMO. But in a situation where you do not have, like the papaya case in Hawaii, you can go ahead and make a decision to actually adopt it. But tomorrow, if you have another approach, you can make a decision to terminate the GMO and go with another approach. So in this case, I would want further clarification. What do we do in a situation where another approach doesn't have any conservation?
In the case where what, I'm sorry, what would do in the case where?
In a situation like Hawaii's case, where the papaya was destroyed and we do not have any other option, what do we do? Do we decide to actually ban the GMO papaya, and the farmer and the consumers of GMO or papaya don't have something, or we make a decision to use it because we are actually not sure what will happen tomorrow?
You've said a lot, and I don't know if I can respond to all of it because we should probably have some other questions. But you just made the case of the Hawaiian papaya, and you know many of you know there was a blight, a serious problem with Hawaiian papayas, and in fact at Cornell, I believe that some of the key research was done in developing a virus-resistant papaya that. There are many claims that it saved the Hawaiian papaya industry. So the question is, well, what do we do? Do we let the Hawaiian papaya industry go down the tubes, or do we use genetically engineered papaya? By the way, I'm just curious, has there ever been safety testing using the whole papaya yet? I'm not aware of it, but there may have been, and I've asked other people, and some people aren't quite sure. That's something I don't know a lot of. Does anybody here know? Has there been safety tests, toxicological feeding studies?
Yeah, there was one study that was actually done by Chinese scientists that was actually used as proof of papaya safety. And it was done on a 28-day rat study, 28 days with rats with GMO papaya and non-GMO papaya. But when you actually look at the results, the GMO-fed rats had higher white blood cell counts, among other alarming factors. That's just after 28 days. And the scientists claimed that they basically ignored that evidence. And so they're already, even though it was claimed that the papaya industry was saved by GMO technology, there is evidence of not of harm right off the bat, but there's strong evidence that shows we should continue safety testing, maybe more than 28 days for mammal testing. And furthermore, I've read that there has been a blight-resistant non-GMO papaya strain all along that was not, we pushed the GMO side of the papaya debate and ignored the non-GMO blight-resistant papaya. So we had a solution all along that was non-GMO that carried no risk, essentially. And that's not quite widely known, but it's been out there for years. So yeah, I think there's more testing to be done on that.
I also got additional,
Just an additional comment on the same topic.
if you don't mind. I'm not sure about his study, but I was in the county council when the ban for papaya came to be, and I asked that question to Dennis Gonzalez, and he told me that in front of the council that there was no health study specifically for the GM papaya. And what he did tell me is that they did a nutritional study to find out the breakdown of the papaya, and the only difference is the calcium. And they did an extensive study to a point to where I asked a nutritionist, and she verified that the study went in depth, that there was really very little difference in a conventional papaya compared to a GM papaya. And when the rainbow papaya came, it was in 1998, and all this time we've been eating GM papaya throughout this time. So if you're looking for an actual study, everybody in Hawaii has been eating GM papaya since 1998. And on top of that, in Canada, it got deregulated in 2003. But I had that concern when I asked Dennis Gonzalez. And so do we burden the GM for additional health study. And that's what I was thinking during the council, and I was trying to figure out what to do from there. So I actually went to our doctors and hospitals to see if there's any cases regarding GM papaya cases or anybody's feeling illness, and I didn't get that. And it's kind of hard to pinpoint that papaya got you sick. So I had to rely on anecdotal references from the community. And some of the anecdotal references was they had a GM papaya outside, and they had a conventional papaya, and the flies won't even go to the the GM papaya. And I'm like, okay. So I had to take everything in part and make a decision, but I do understand what you're trying to say. And the question is, should you have further study regarding the health concerns on GM papaya? And should we do it now since it's been out there since 1998? And I wanted to know what you think.
Can I just clarify a few things about your question? So you said you were a councillor from Hawaii?
My name is Gregor Iligan. I'm a council member in Hawaii County. I was elected there in 2012, and we went through the ban of GM papaya. And thanks to Alliance for Science, I happened to come here with Amy Harmon. We had a New York Times article in Only Quest for Facts. And I actually was looking to have dinner instead of coming here. But instead, we fell here, and you guys have outstanding cake and coffee. So thank you very much.
So yeah, thank you for that clarification. So I'd also ask a question in this case, which speaks to the gentleman's earlier question about, I believe there's still non-GMO papaya farmed in Hawaii, is that correct? There's something like 20% of farms or 20% of the trees are non-GMO. Am I correct in that?
I would represent the District of Puna, and pretty much 80 to 90% of the production is GM papayas.
Okay, so most, but not every last one. Yeah. So in this particular case, for example, the GMO choice is not just a question of no papaya or GMO. There is a third option, and so I'm kind of interested in, there is an important issue. If you can't grow any food at all, do you want to then choose a GMO? Right? That would be a conundrum. Right? That would be different from the conundrum of if you have a choice of conventional breeding or you have a choice of various options, whether you would then choose a GMO. And so I can talk a little bit about this from my perspective, but perhaps seeing as we have a speaker here who's visiting from out of town,
well,
do you have
I do,
you would like to
because
say?
you're a virologist, it would be good. I did, just generally, because, and again, I know that there are people with so much knowledge speaking, and I have to apologize, I haven't been able to hear a lot of it. It's my hearing and the way the echoing is, and it's difficult for me. So I'm going to have to rely on Jonathan, who did hear more of it, to give more of the answers, because I won't do justice to what you're all asking me. But one thing I did remember when I was speaking that I should have mentioned, it was on that one study, the very important 2-year study that was eventually retracted under great pressure. It did get republished in another peer-reviewed journal. So it currently is published. So the other side always tries to say, oh, it was retracted, and try to belittle the fact it's republished. But it was republished because it had gone through peer review a couple times already, and it was recognized it was quite unjust that it had been retracted. I just want to generally, and I'm not trying to beg off on anything that's been asked, I want to just mention one thing though, because I think it speaks to this geneticist who's sitting in the front pew here, generally to your question, and that is, what about the future of agriculture? Is there, or do we really need genetically engineered crops to meet the nutritional needs of the world, to make sure we have sufficient drought-resistant crops, crops that are flood-resistant? do we need them? Now, we know there are many scientists, thousands probably, that will tell you that we do need it. And I know that they sincerely believe that. But I think it's also important to, as a matter of balance, to keep in mind that there have been very important studies conducted on the future of the world's food supply and the various means of meeting it. One of the most important was conducted in 2008, sponsored by the World Bank and 4 United Nations agencies. It was a 4-year study on the future of farming. It's referred to as the International Assessment of Agricultural Knowledge, Science and Technology for Development. Now, it was conducted by more than 400 experts from 80 countries. 58 different governments have endorsed it. And its assessment of genetic engineering flies in the face of those claims that it's essential, because it concluded, this study, that genetic engineering is not essential for solving the problem of hunger. And when the project's director was asked at a press conference whether genetically engineered crops were the answer to world hunger, he replied, quote, "The simple answer is no." So, you know, we do have to take that was a lot of experts studying it, and I don't think they were all anti-GMO activists. And so anyway, I think that has to be taken into consideration. There have also been many studies conducted in sub-Saharan Africa and the third world that have demonstrated that small-scale agroecological techniques, which are the kinds of techniques that this report endorsed, actually can create greater gains in productivity than industrial approaches have been able to do, even when supplemented with genetic engineering. So I did want to bring that in. It may not satisfy the gentleman here, but it's certainly, I think, part of the big picture that we should take in. I'm going to let you decide who gets called on.
Sure. Let me just ask a question. Are all the questions about this particular subject of how you compare GMOs with regular plant breeding? Because if somebody does have a question that's relevant to this, perhaps we should take that one first. There's a gentleman here who seems to have.
Is that me?
Yeah.
Yeah, I think what I was going to say is very relevant to what the speaker just said. I work at Cornell on organic farming research, and I think that there's a huge sort of imbalance in our approach to agroecological research. We tend to put a lot of money and a lot of effort and a lot of people into a more reductionist approach. There is really not much in the way of holistic types of approaches, which I think support what the study that you just mentioned, that sort of a bottom-up, small-scale approach to world hunger may be the most effective way to deal with it. So in my own experience, I feel that there's this trade-off, and putting all of our eggs in the GMO basket is, I think, extremely unwise.
Hello, my name is Aditya, and I have a very simple question. You're a public interest lawyer, and mine is about regulations. You've spoken extensively about how the FDA here and the regulations here are a problem, but what about countries where the government itself, and without any private bodies coming into play, has gone ahead, researched on gene technology, has produced products on it, and has distributed it free of cost to the farmers. So there's no big ag or there's no private enterprise which is involved in development of it. They have conducted extensive field trials and extensive safety trials before they took it to the public, and have commercialized it quite successfully. So what happens in places like that? The regulatory authorities themselves are doing the research and they're doing it extensively. So is that a question of the government poisoning the people? I mean, recently Bangladesh has done the biggest difference.
Just paraphrase that for our speaker. So I believe the question is about whether is it an ethical question you're asking, or are you wondering whether the crops would be safer because they're developed through public plant breeding?
I'm saying that, you know, when it comes to the contention, that the safety here in America is contested because the government or the FDA is not going through the regulatory process, but there's places out there where the government itself is developing it. So is that a problem in terms of the government poisoning the people, or is there any other explanation for that? They are conducting extensive field trials in countries like Bangladesh and have commercialized it very well. BT Brinjal has gone through about 8 years of field trials before it hit the market. The regulatory authorities themselves are doing it. Isn't that a plus for genetic engineering?
Which is the crop that's gone through 8 years?
BT Brinjal.
Brinjal. Okay, this is eggplant.
Yeah, exactly.
Yeah. So I think the question is, does it change anything for you if a crop is produced by a public breeding institution? Is that a fact?
Yeah, it's a public. It is by Bangladesh Agricultural Research Institute, which is a public institution. Yeah, totally.
No, actually, I think the question then was, does it make a difference to me whether a genetically engineered crop has been produced by Monsanto or some other big biotech company, or by a foundation or a public entity? Was that it? And as you might have noticed, I don't even know if I mentioned the name Monsanto except in identifying that one particular crop. My book doesn't really focus on the socioeconomic side of this. Many people are just arguing that, you know, we want big corporations out of it, and they're concerned about corporate takeover. And from that perspective, then if there's no food safety issue, then it's fine if GMOs are being developed by the public sector. I'm focused on the issue of food safety and risk. So from that perspective, it doesn't make a whit of difference who develops the crop. It just makes a difference whether the crop, the risks have been acknowledged and if they've been properly tested for. And probably there is more likelihood that the truth will be told and the proper testing, or at least some measure of better testing, will be done if it's conducted publicly. But that's not always the case, unfortunately. But my book really doesn't focus on the socioeconomic things. I don't make an issue about food sovereignty. Many people do, but I wanted to keep the focus primarily on food safety and also on the suppression of evidence and the distortion of evidence that have been happening.
Hi. I live in GMO country. I'm not a scientist, but I have some observations that I'd like to mention and see if you have any comment on them. First of all, twice a year, these machines called terminators come, and they start spraying. Why they call them terminators, I don't know. Well, maybe they know. But they spray the glyphosate into huge clouds that permeate the neighbors' yards. People panic, they're closing their windows, they're driving away, they don't know what to do. They're growing corn, soybeans, alfalfa, and I have noticed that let's see, they started about 2 to 3 years ago. All of a sudden, the deer population is gone. Now the deer, of course, are in those fields eating that GMO corn and alfalfa and soybeans, and they're also eating the glyphosate. How careful should people be? I did actually call the farm and complained about how that those clouds of glyphosate, permeated the whole area, and they said, "Oh, everybody should be very safe." Well, I'm not so sure, especially now when I see the deer disappearing. I don't know if it's coincidence. I don't know what it is. Have you observed anything like that? And has anybody ever tested, like deer, taking blood samples or anything from the deer to find out, like in an area like that, if they have glyphosate, and should people be tested for the glyphosate in an area like that?
Did you understand the question?
I couldn't hear it all.
Okay. the question is about Roundup, glyphosate.
I knew that.
So,
I'm hearing about every other word. It's just enough to mess up my comprehension. I'm sorry.
This person has, the question has observed Roundup being sprayed in fields near your home. This is in upstate New York, is that correct?
It's near Ithaca.
Okay, thank you. And GC's observation of contamination, and there's a question for her of whether this is affecting deer or maybe other wild animals, and whether people should be tested for Roundup contamination whose homes this enters into. And I know that's a little way away from the subject of your book.
Just say that recently a panel, I believe it was a panel of the World Health Organization, in reviewing all of the data on glyphosate, came out with a statement or a finding that glyphosate should be ranked as a probable human carcinogen. Now, the state of California has taken it a bit further and just very recently branded it as a human carcinogen, and that 2-year study that I referred to on a glyphosate-resistant crop, the corn, showed that, and they had different experimental groups. And remember, one group didn't even eat the genetically engineered corn. They just had a small amount of glyphosate added to the drinking water that was just about the same dose that one would get from eating the corn, the residue that would be there. And that also showed the kidney and the liver damage. All the other problems were there just with that. So I think that just those 3 pieces of information alone are enough to show that it would be very wise to take a precautionary approach on it. Whether it's affecting deer and whatever, I mean, I'm not an expert on herbicides and on all of that issue. If somebody else is, they could comment. But I think just alone, that's enough to know that certainly there is a presumption that glyphosate, it should be avoided if we can, because in my book, that's scientific information that certainly weighs heavily. By the way, did you ever get a chance to speak about the Hawaiian papaya from the standpoint of a virologist? I thought you were going to.
I could, but
because I want to make sure. I can't tell whether we adequately discussed that issue because I couldn't hear what everybody was saying, and I'm so sorry. But if you feel that it wasn't adequately discussed and you'd like to add to it or discuss it more, go ahead.
Maybe if we run out of questions, we'll have
okay, then we'll come back to it. Because I don't want anybody to feel, I'm not trying to evade it, I just am having trouble picking up everything you're saying. I'm sorry.
We have a question.
Hi. Yes, hi. Welcome to Ithaca and to the Unitarian Church. I really appreciate your book and the fact that you're an attorney and you use that to my advantage. Thank you very much for protecting the public with what you do. My question is, in light of what you know, now what do you eat? And secondly, in light of what you have released, and there is an impact on Monsanto, because when people find out, then they don't want to eat that anymore. So, in light of that, do you have any fears about your life? You are going to affect them, and so I'm wondering if you have any fears after you wrote and published this book.
So 2 questions. One is, what do you eat? And do you have any fears for your life as a consequence of writing this book?
Well, I and my wife for many years have been endeavoring to avoid eating any foods that contain GMOs, and it's extremely difficult in the United States, and in Canada, by the way. Canada is really about no safer than we are. It permeated, my wife's Canadian, so I often go to Canada, and it's extremely difficult there to avoid them, especially without labeling. And so if you want to avoid GMOs in the US, it's difficult. It's easier in the last few years with increasing number of packaged foods on the market that have the certification of the non-GMO verified project. That makes life a lot easier. But it is difficult, and sometimes I've basically had to eat a fairly meager meal just to rule out the possibility of eating GMOs. But that's just me, A, for my own health, but also I feel otherwise I'd be hypocritical. I'm always telling people to avoid them, and I'm trying very rigorously, even though it's a pain when I'm traveling. Secondly, many people, actually from the very beginning, even before the lawsuit was filed, many people have been warning me about my life and to be careful. And very early on, I just had to make a decision. Either I'm going to go ahead and do what I think I need to do, or I'm going to become afraid and be ineffective. And I decided if I'm going to succumb to fear, I'm not going to be able to do it. So I just actually separated myself from people that were always warning me and just decided I'm going to go ahead. And fortunately, I'm still here, but there have been some pretty scary warnings people have given me, and some of them. So anyway, thank God, and I just hope to continue.
About 10 years ago, I saw a documentary about a Canadian farmer that was in a legal battle with Monsanto, and he said that the GMOs, I don't know, the seeds of the grain, received 6 to 8 times as many pesticides. And I was wondering, is that true today, that the GMOs get sprayed pesticides 6 to 8 times more than the conventional crops? Is that true today?
Do GMO crops, are they sprayed with more pesticides or less pesticides? And can you tell us which crop you're referring to?
I'm not sure. This was at least 10 or 15 years ago. I don't know if it was corn or what it was, but he was, in a big battle with Monsanto, and he was losing so much money, trying to fight the giant.
I think she's talking about Percy's.
Again, almost anything I say is going to be controversial, but it does depend on the crop, because there's a whole line of genetically engineered crops that were designed to produce their own pesticide. Now, to the extent that that pesticide is broad enough spectrum and actually efficacious and the pests haven't developed resistance, then theoretically they don't need to be sprayed. In practice, some of them have had to be sprayed with one or another one depending. My understanding is, though, that the evidence as a whole shows that there probably has been a reduction of pesticide on the average because of these pesticide-producing crops. Doesn't say, but there have been pesticides added to those crops via being coated on the seeds. So are we talking about spraying, or are we talking about total pesticide that's been added? Because when we talk about the neonicotinoid coatings that are put on the seed and then they actually permeate into the cells, that's a whole nother issue. And somebody else might be able to say whether on the whole there's still been an increase, but certainly if we only focus on what's being sprayed, we're missing the total pesticide picture. If we talk about GMOs that have been engineered to resist one or another herbicide, well, they have been engineered to actually invite more herbicide being sprayed in amounts and at times that couldn't have been done otherwise. And so the best data I've seen shows, not surprisingly, that they've caused a great increase in herbicide use, and not just those crops directly. In fact, as I remember the data, and again, anybody can correct me if I'm wrong on this, perhaps the greatest increase of herbicide use within recent years has been because of the development of herbicide-resistant crops, and they have actually necessitated increased use of herbicide. But those herbicide-resistant crops are a direct result of the widespread, really, overuse of herbicide because of the herbicide-resistant crops. So it's kind of a vicious circle we're talking about. Anybody who has more data on that is free to add to it or correct it. I don't spend as much time on the environmental side, so I could be slightly off on that, and anybody else could fill it in more or correct me.
I think that's a pretty accurate description. It certainly follows my understanding that, but it's very difficult to quantify the differences, because USDA is counting sprays when they basically measure pesticide use. They're not counting the BT, the insecticide that's inside the crop. There also has been much more increased use of seed treatments in the last 10 years or so. But it's not easy to quantify. You know, those are used in different ways. The BT crop, the BT gene, the protein that's expressed is expressed in the crop all the time. Whereas when you spray a field, you can measure how much you are adding to that field. So it's not easy actually to compare previous usage with present usage. But in many cases they've gone up. We've got a question at the back.
I have 3 related questions, and these are sort of legal questions. Do communities have the jurisdiction to require labeling within that jurisdiction of GMO products? And the second is, do communities have the jurisdiction to restrict the growth of GMO crops within their jurisdiction? And then the third question is, some of the companies now are developing RNA sprays as an alternative to actual genetic modification. And can you suggest language that as these GMO laws are passed, that they would include the RNA technologies?
You'll have to do it.
So the question was, there were 3 parts to this question. One is can you make a suggestion of how labeling of RNA sprays might be done? Of RNA sprays, so GMO RNA sprays.
Let me just answer that our way. I'm going to let somebody else answer that one. I don't know if I could answer or suggest how to label RNA sprays, so I shouldn't even hazard an answer on that one.
And the other question was about whether communities have the legal right to label GMOs within their own communities, or else was it to label GMOs that are grown in the community, or to restrict the use of, restrict their growth in local areas, county level or city level or whatever it might be, but also to ask for labeling.
In terms of labeling, I think you know that the state of Vermont, the legislature passed a bill to require labeling that will go into effect next July unless a bill that was recently passed by the House of Representatives gets passed by the Senate and then signed into law by the President. That would basically prevent any state from doing what Vermont has done, and certainly any locality from doing it too. And so again, the big issue is, will that pass the Senate? And if it does, will it be signed by the President? So if it does pass, Vermont's law will be nullified, and other laws that have been passed that have triggers on them, they will become moot, and what you just asked will, it won't be possible. Currently, it seems to be legal, and Vermont, my understanding is that Vermont's bill has been challenged by the industry and so far has prevailed in court at every level. I don't know exactly, I'm not up to date on how far, but my understanding is that it appears that that law has withstood the main legal challenges. So it will probably go into law unless Congress nullifies it and prevents it. Then there have been, in many states, several counties or localities, I think, have put up restrictions on growing genetically engineered foods. Some states probably have laws banning that altogether. There are some states which give local control. So again, I have a feeling that there might be more moves in state legislatures to try to prevent that too, if some of these strong business interests can get leverage. But again, I'm not up on what's happening in every state, but I do know that certainly I think counties in California and some in Oregon, and I'm sure there are other ones, have put in place bans against growing genetically engineered foods.
Yeah, let's take this question.
Okay, my question is, I just realized that your focus is not for food security, but for food safety. And out there are scientists that strongly against GMO or genetic engineered products. And why you will not encourage those scientists to work together with the scientists who pro genetic engineered products to fix the problems or something wrong in the products of genetic engineered products and make it better. And if that happens, would you mind to change your perceptions about genetic engineered products if there is a strong evidence that proves that genetic engineered products is safe? Thank you.
So I think the question is, would you be happy to work together with scientists who think that GMOs are safe? But I wasn't clear whether your question was to do with to do an experiment or just to have a discussion.
Both of it, because you cannot just have a
Both.
discussion with an experiment.
Okay, great.
To work with them, to have a discussion with them? Yeah, and then wasn't there a last part of the question that if a GMO could actually be proven safe, would I be opposed to it? Okay, so I am open to discussing, dialoguing, coordinating with anybody. I mean, that's why I'm here. I was speaking in classes at Cornell, and there are many scientists at Cornell that disagree with me. In fact, one yesterday told me I should be ashamed of myself for what I'm doing, and I was trying to dialogue with him, but unfortunately I didn't leave that classroom feeling ashamed, but I was perplexed, and that's why I actually was eager to meet with Dr. Davidson, Evanegna. I probably just made a mistake on that, I'm sorry. But I really was pushing to meet with her because I really wanted to. I felt it was important, and I'm very grateful she did too. And I'm looking forward to dialoguing with the Alliance for Science. In fact, if they haven't changed their minds, they actually want to interview me early tomorrow morning before I have to drive to Boston. So maybe after I've spoken, they don't want to interview me anymore, but I'm still willing to get up early and do it. And I think that's a great attitude. And as I've said, and I mean it, I'm willing to learn from anybody. And in fact, at the very first press conference, when my book was introduced to the world on March 4th, it was in London, Jane Goodall was there, and I actually challenged at that point, I issued a challenge to the Royal Society. I said my book documents several instances in which statements made officially by one of your publications or by a president or a key official with the Royal Society have made false statements, and I documented them. And I said, first I demanded that they revise them and set the record straight, which they still have failed to do. And I also challenged them to go through my book and to document any assertions of fact that they could solidly document were false. And I'll invite anybody here to do that, because if there's a false statement of fact in my book, I want to correct it. You know, I wrote this book to try to clear up the confusion, not to add to it. So, and I've challenged Monsanto to do that too, by the way, and they've evaded it. Now, it's not the fact that the Royal Society didn't know about that. Some eminent British diplomat who attended not that conference, but a talk that I gave at the House of Lords that afternoon came up to me and said, I just so happened to have an appointment with the president of the Royal Society in another day, and if you have an extra copy of your book, I will deliver your book and you can send him the challenge. He said, I don't think it'd be diplomatic for me to deliver the challenge too, but he delivered the book. The challenge was sent by me to the president, who definitely got it and acknowledged it, and he dodged retracting anything or reading the book and dealing with the challenge. So I feel that's unfortunate. Now that, you know, I was pretty confident I wouldn't have publicly challenged them, because if my book really is weak, it's going to get taken apart by somebody and I'm going to look pretty foolish, and then I will be ashamed of myself. So, but it's only because I spent so many years researching writing and so many scientists have vetted it that I feel confident. Not that every little statement, there may well be some little statements wrong or some miscited reference, and I want to change that if it's there. And certainly if there's any false logic that any logician could agree with, yes. Certainly many of my broader conclusions, there's going to be room for disagreement in that, and reasonable minds can disagree. But the main thing I want to do is let's find out where the facts are, and let's make sure we're all talking about the same set of facts, and then we can have dialogue, and intelligent dialogue. But as long as the facts are being often twisted or suppressed, that doesn't really fly. And I think it's important that we can at least, be talking about the same world of facts, and then there's going to be a lot of room for different opinions. That's going to be inevitable. And I like dialogue. I majored in philosophy. I really think that's how truth and knowledge expands, by vigorous dialogue and back and forth, and I like that, as long as the other people are playing by the same rules I am. And I'm confident that the Alliance will be. And I'm sure that many of you in this room who disagree with me on some things still would like to be part of that kind of a dialogue. And so I hope that, I just want that dialogue to continue, and questions to be raised, and at least the facts to be understood.
So I'd like to add a little bit to that. We'll go to this question in a second. There is an issue in that it's incumbent on the people who think that GMOs are safe or would like them to be approved to find out what the critics think. Right? So, I've written articles about, for example, RNA interfering GMOs, and I've talked to the head of the British GMO Safety Committee, and I tried to explain to him what my issues were with using small RNAs in genetically engineered crops. And it was obvious to me he didn't really understand what I was talking about, which was not surprising because he's not an RNA biologist. I also know that there was no RNA biologist on the committee that he headed. And so, but he could have come to me and asked me to explain in more detail or in more, whatever ways he wanted, to explain what my issues were. But he declined to do that. Okay? And so, if you have an issue with GMO safety, you do have, you can try till you're blue in the face sometimes to explain to people that you really think there's a scientifically valid criticism and concern, but if they don't want to come back and talk to you, there's very little that can be done about that.
Oh, I don't know if I answered your second question. What if one were actually proven safe? If one were proven safe according to the level of testing that I describe in my book as what I think would be, not just I, but experts think would be minimally necessary, then yes, I might look at that with a favorable eye. I just don't think that's going to happen. I don't think that level of testing is going to apply to any GMO, but if it is and it successfully passes it, I'll keep an open mind.
Well, my question is nearly obsolete, but considering that molecular biology is here to stay, and I'm sorry, can you hear me now?
Yeah. As long as the other people can get it, and I'll pick up. I'm going to come close to you since you're so maybe that'll help.
That's not you very well with this microphone. But considering that molecular biology is here to stay, and of course considering maybe we're not using it the right way, and there's obviously these incredible safety issues involved, and assuming that most people, well, I can be a cynic, but for most people who are actually working on things like international development or food and agriculture generally, do want safe products and do want the truth, to know the truth. First of all, how do you see the next steps in now this amazing work that you presented, which I think is an amazing step, a great step to being able to, I think, more rationally bring a more wholesome discussion to people who have looked on the widest possible objective way. Of course, we're all, but maybe they're not, but we're all creatures who build on previous knowledge, and when that previous knowledge is incorrect, then the whole end product fails. So I would therefore ask you, what do you see the next steps to be? And maybe specifically in one area, in terms of experimentation and testing, would you, and how do you see, for example, these testings of these 2-year testings that you've mentioned, the European tests that came out with some very worrisome information? Would you say that should be repeated? Is it going to be repeated? That you were referring to, yes. And so would that be part of that move to make it repeated? Perhaps the marker enhanced breeding, whether that kind of work should also be subjected to some longer-term testing so that the markers are shown to be safe, and if it is, then that would help a tremendous amount. I don't know, perhaps it already has, but to my mind, those will be interesting in the next moves.
So there's a lot in that question. One of the main ones is where do I see things moving? Well, as I mentioned in the beginning, actually, I do feel that as more facts are disseminated, and as people, and also I think as many life scientists who themselves don't do genetic engineering or are not plant biologists have had to rely on many statements from those who do. And there's a chapter in my book that describes how so many of them really are saying things that they think are scientifically proven that aren't. And that when scientists who know begin to explain to them some of the simple facts and clear up a lot of the misconceptions, it doesn't take long for them to start changing their thinking. And I think as that starts happening more, I think there's going to be a major change. I still kind of have a naive belief that the truth is very important and the truth shall set ye free, and that really ultimately when the facts are known, that there will be a major transformation. I have to again just state, because I mention it in fact it's part of the last chapter of my book, which does look ahead. I do think that the decision, if we're going to talk about now also a policy decision, that the risks of genetically engineered food are sufficient, and the level of testing to demonstrate that one or another is truly safe to the level that I think information science requires, and biological science, it means that it would be much better to redirect our resources and because so little money is being put right now onto many of these creative small-scale agroecological methods. And there are amazing success stories. It's just astounding. And again, there's not one size fits all. Different ecological niches are going to have different approaches. That's why it's so important that we do have so many different projects going on and finding out what works in this particular ecological niche, what works here, because what works in country A or even region B of a certain country may not work elsewhere. But we know that creative, small-scale, and environmentally friendly approaches have been producing some amazing results. And getting back to the papaya question, I know I have heard, and maybe I'm sure there will be disagreement, but some people have stated that, well, the blight in the first place was a result of monocropping, that if we hadn't had all the monocultures and we had had a more diversified agriculture in Hawaii, that probably wouldn't have happened anyway. I had heard claims that certain, ring spot virus wasn't affecting organic farms in the same way. I don't know if that was true or not. I heard that from an organic grower when I was in Hawaii. That would be interesting to find out if it was or it wasn't. But I think what is needed, the question is, I think almost everybody has agreed that somehow conventional breeding, just conventional, I'm sorry, not conventional breeding, I should state industrial agriculture, the way it's being done, is not well suited for most of the third world. And there's growing concern about whether we should continue using it in such a broad way in industrialized countries. And so I am a proponent of beginning to have a greater transformation in agriculture where we are using less herbicides and less synthetic nutriments. The word isn't coming up, but yeah, synthetic chemicals. But the things are having to be put in because the soil's so depleted now, and there have been so many examples, so much research conducted that shows the potential. And the claim often is being made that industrial agriculture can outproduce these agroecological techniques. That's only if we're focusing on a monoculture. But if we're actually focusing upon the amount of nutriment created per acre, then there's extensive evidence demonstrating that diverse small farms that grow a variety of crops that are not doing monoculture, they actually are producing far more nutrient density per acre of land than any big industrial monoculture can do. So it's whether we're focusing on how much corn you can produce per acre or how much nutritive value you can produce per acre. And if we're focusing on the latter, which is more important, I think, then small-scale agroecological has been demonstrated to win. So I think it's important. Doesn't mean that every farm in America is going to be able to be run on a small-scale basis, but a lot more of them could be, and there could be much more diversification. And in the state I live in, there are many people saying, why are we only growing corn and soybean? We used to have such great soil, we could grow such a diversity of crops, and it's just not being done, but it could be done.
Okay, we have one last question, and then you can surround Steven and Jonathan and Allison over here. We've got organic cookies, I believe, and coffee. One last question, and continue the discussion in the parliament.
Are you happy to give a quick answer? Because it's 9:10.
I don't think so. I went pretty long on that one. If somebody else has a question.
Those of us who've been studying this and researching this for a number of years understand that there's very large, powerful financial interests that drive biotech. And I was wondering, during the research for your book, did you look into or come across how financial interests influence regulatory policy within the FDA? And could you talk just briefly about how powerful people in industry go between their industries and then get high-profile positions in the FDA and then back into industry? Thank you for coming.
It was about regulatory power of the industry and, for example, revolving doors. I think Michael Taylor is one of the signatories of the FDA's 1992.
My book does talk about the history of the development of U.S. regulatory policy, relying on books on the, a very good history book on that, on newspaper articles, and on a lot of first-hand information that was given to me by one or another scientist who was involved. So that story is told within the book. It's interesting. Some of the people that are trying to detract from my book and have written so-called reviews, which just make me laugh. I mean, they claim my book is full of wild conspiracy theories about, all these conspiracies between government and industry. I actually checked my book. I did a word search. The word conspiracy isn't even in my book. I didn't want to use that. And in fact, one of the sources that talks about Monsanto's influence over the government was a New York Times article. I just cite that article. So I'm not cooking up any wild things. And in fact, my main goal was not to try to develop any kind of conspiracy theory anyway. But it's impossible to do a good history of the development of genetic engineering without talking about the financial power of the industry over our government. But my book makes a very important point, I think, and that is that the groundwork deceptions and the major lobbying, the first major lobbying of the US government that prevented most regulation was conducted before there really was even a biotechnology industry. It was conducted by mainstream molecular biologists and many American universities and scientific institutions. That's documented in the book. I think that's very important because my book makes the point that the main problem has not been the biotech industry. It has been scientists who have actually been abusing their authority, and that has continued. And without the deceptions that have been perpetrated by many scientists and scientific institutions, what Monsanto has done, what the FDA has done couldn't have happened. And in fact, there's this term, the halo effect. Monsanto would much rather have a university-based scientist make statements that it wants rather than its own officials, right? Who are you going to believe more, a university scientist or some spokesperson for Monsanto? So they love it when they can, when scientists such as that will make statements for them. And apparently, actually speaking of New York Times, there was a recent article that was exposing some of the, let's say, less than savory relationships between some university scientists and the industry. So, but I don't have that particular one in the book because it came out after my book was published.
So I'm not going to stop questions anymore, and so I'd like to end the questions and suggest that people can come next door. I wonder if there's anything wrong with this microphone. And come next door and eat some food. Probably people are hungry, but I'd like really especially to thank the speaker tonight, Steven Druker.
Thank you all for your attention and staying through this long question and answer period, and thank you for putting up with my lack of hearing, and it made it more difficult. I do want to quickly, people can be walking out, but the geneticist, the front pew here, I know I didn't do justice to all of his questions, he handed me a couple, and I'll just read them and answer them for his benefit and the benefit of anybody else who wants to stay here for a moment. And that was, one, why would we trust FDA on conventional plants but not on GMOs? Number two, why would we trust private companies for conventional seed but not on GE seed? Well, the simple answer on the first one is we're not trusting the FDA on conventional plants. They're not regulating those. By law, they don't have to be regulated. And we're basically trusting nature, and we're trusting thousands of years of history that by and large, eating conventionally produced plants has been safe. And in the few instances that we know of where some naturally occurring toxicant has been elevated, breeders have been able to actually discern that anyway, and they didn't really get out and make a major problem. But there have to date still been no instances of novel toxins being produced in conventional breeding that were not already within that species already. We've only had instances of the elevation of toxic chemicals that have already been within the species. And the same thing from private companies. Conventional seed doesn't, according to the FDA scientists and many independent scientists, conventional breeding within naturally available sexual pathways doesn't entail the same level of risk of using recombinant DNA technology. So they really are very different. Those are the answers I give to you. I'll be happy to talk with you more during the break, and I'm so sorry that I didn't do justice to your other questions.